You know those everyday pills we often take for aches and pains? Well, could they be secretly harming our kidneys? It's something many of us do, reaching for common painkillers without a second thought, often unaware of the potential silent damage they might be causing. So today, we're going to shed some light on 5 widely used analgesics that could impact your kidney filters. We'll talk about the risks involved and, importantly, share some essential advice on how you can use them more safely to protect your health. Number 1, ibuprofen. First up, let's talk about ibuprofen. Now, ibuprofen is a household name, isn't it? It's widely recognized and frequently used as an over-the-counter, non-steroidal anti-inflammatory drug, or NSAID for short. So many people turn to it to ease all sorts of discomforts, things like headaches, muscle strains, menstrual cramps, and even those aches that come with a cold or the flu. It's so popular because it's really effective at reducing both pain and inflammation, making it a staple in many of our medicine cabinets. But while it certainly offers relief for a lot of us, it's really important to understand its potential impact on the body, especially on our kidneys, to make sure we're using it safely. So, how exactly does ibuprofen work, and why can it affect your kidneys? Well, the way it reduces pain and inflammation can, unfortunately, have a downside for these vital organs. Ibuprofen works by blocking the production of substances called prostaglandins. Now, while some prostaglandins are involved in causing pain and inflammation, which is why ibuprofen helps, others play a really important role in keeping enough blood flowing to our kidneys. When ibuprofen reduces these protective prostaglandins, it can lead to less blood flow to these essential organs. And over time, especially if you're taking high doses or using it for a long period, this reduced blood flow can put a strain on the kidneys. This could potentially lead to something called acute kidney injury or even contribute to chronic kidney problems. Essentially, the kidney's delicate filtering units can get damaged, making it harder for them to effectively remove waste products from your blood. It's also important to know that certain individuals are more vulnerable to these kidney-related side effects from ibuprofen. For instance, people who already have kidney conditions like chronic kidney disease are at a much higher risk because their kidneys might already not be working at full capacity. Older adults also tend to be more susceptible, partly because kidney function can naturally decline as we age. And something else to consider is that taking ibuprofen at the same time as other medications that can also be harmful to the kidneys, what doctors call nephrotoxic drugs, can really increase the risk of kidney damage. This can include certain blood pressure medications, diuretics, and even other NSAIDs. Recognizing the warning signs of kidney damage from ibuprofen can be a bit tricky, as symptoms often don't show up in the early stages. However, if kidney function starts to decline, you might notice things like swelling in your legs, ankles, or feet because of fluid retention. Other potential symptoms to watch out for include unexplained fatigue, shortness of breath, feeling nauseous, a decrease in how much you urinate, or even changes in your urine color. If any of these symptoms pop up, especially if you've been using ibuprofen regularly or in high doses, it's really important to talk to a healthcare provider as soon as possible. So, how can you use ibuprofen more safely and minimize the risk to your kidneys? Well, the general recommendation is to use the lowest effective dose for the shortest possible time. If you find you need long-term pain relief, it's a very good idea to chat with your doctor about alternatives. There are non-medication approaches like physical therapy, using heat or cold packs, or making certain lifestyle modifications that might really help. For those who do need to use ibuprofen, staying well hydrated is key because dehydration can make its potential negative effects on the kidneys even worse. Always make sure to follow the dosage instructions on the label or those prescribed by your doctor. And if you have any risk factors for kidney disease, it's crucial to discuss using ibuprofen with your healthcare provider before you start taking it. So, while ibuprofen is definitely a useful medication for many of us, its potential effects on kidney health just can't be ignored. But here's the thing. Ibuprofen isn't the only common pain reliever that comes with these kinds of risks. There's another very familiar medication that also deserves our careful consideration. Number 2, aspirin. Alright, moving on to aspirin. Aspirin is another one of those widely used non-steroidal anti-inflammatory drugs. It has a really long history of being used to relieve pain, reduce inflammation, and bring down fevers. But beyond these common uses, you might also know that low-dose aspirin is often prescribed for its heart benefits, specifically to help prevent heart attacks and strokes in people who are at risk because of its blood-thinning properties. Because it can do so many things, it's found in many different forms and is taken by a huge number of people all over the world, often without a complete understanding of its potential side effects if it's not used exactly as directed. Now, despite its benefits, especially for heart health, aspirin does carry risks for our kidneys, particularly if it's used for a long time at high doses. This kind of use has been linked to a condition called analgesic nephropathy. That's a form of kidney damage caused by taking pain-relieving medications over the long term. This can lead to something called chronic interstitial nephritis, which involves inflammation and scarring inside the kidney structures. Ultimately, this harms their ability to filter waste and function properly. The tricky part is that this damage can be gradual and might not show any obvious symptoms until a good deal of kidney function has already been lost. And the risks to your kidneys can actually get worse when aspirin is taken in combination with other painkillers or certain substances. For example, if you're using aspirin along with other NSAIDs, that can increase the chances of kidney-related problems. What's more, some combination pain relief products, those that include aspirin mixed with caffeine or codeine, have been particularly linked to the development of that analgesic nephropathy we just talked about. It seems the combined effect of these ingredients can put a bigger strain on the kidneys than aspirin would on its own, potentially speeding up damage if they're used too much over long periods. Certain groups of people should be especially cautious when it comes to using aspirin because they might be more susceptible to its kidney-related side effects. Older adults, for instance, often experience a natural decline in kidney function as they age, which makes them more vulnerable. If you have a known history of kidney problems, like chronic kidney disease, or if you've had kidney damage from medications in the past, you should approach aspirin with extreme care and only under close medical supervision. Similarly, even people with cardiovascular disease who are often prescribed low-dose aspirin for heart protection should have their kidney function regularly monitored. It's all about carefully managing that balance between benefits and risks. So, for safer use, if you're taking aspirin for pain relief, the advice is generally to use the lowest dose that works for the shortest time needed. Now, if you're on long-term low-dose aspirin for heart protection as prescribed by your doctor, please don't stop taking it without medical advice. However, do make sure your kidney function is being regularly monitored. It's always a good idea to discuss your aspirin use with your healthcare provider, especially if you have any underlying health conditions or if you're taking other medications. They can help figure out the right dosage for you and assess your personal risk factors for kidney complications, making sure you use this common medication as safely as you can. So, as you can see, aspirin, much like ibuprofen, needs to be handled with care, especially if you have certain health concerns. Now, let's turn our attention to a pain reliever that many people think of as being a bit gentler on the system. Number 3, acetaminophen, paracetamol. Our third common painkiller is acetaminophen, which you might also know as paracetamol depending on where you are in the world. This is one of the most widely used over-the-counter medications out there for easing mild to moderate pain and bringing down a fever. You'll find it in remedies for headaches, muscle aches, and those common cold and flu symptoms. Now, unlike NSAIDs, such as ibuprofen and aspirin, acetaminophen doesn't usually affect inflammation all that much. It works through different pathways in the body to relieve pain and reduce fever. And because of this, many people see it as a safer option, especially for the stomach, when compared to NSAIDs. But here's something to keep in mind. While acetaminophen is generally thought to be safer for the kidneys than NSAIDs, when you take it at the recommended doses, it's not entirely without risk. This is especially true with long-term use, or if it's taken in combination with other substances. Using acetaminophen for a long time at high doses, particularly if it's combined with NSAIDs or things like caffeine or codeine, can actually contribute to kidney damage. You see, our kidneys play a role in processing and getting rid of acetaminophen and its byproducts from our system. If there are excessive amounts, it can overwhelm these processes, and that could potentially harm the delicate kidney filters over time. One of the big concerns with misusing acetaminophen, whether that's chronic overuse or an acute overdose, is the risk of, you guessed it, analgesic nephropathy. This is that condition we mentioned, characterized by damage to the kidney tissue, which can impair how well your kidneys work. Now, while liver damage is often the risk that gets highlighted most with acetaminophen overdose, it's important to remember that the kidneys can suffer too. This risk goes up when acetaminophen is part of a combination painkiller product that's used regularly for long periods. The cumulative dose can really add up without you even realizing the potential impact it's having. So, knowing how to use acetaminophen responsibly is really crucial for protecting both your liver and your kidneys. Always, and I mean always, stick strictly to the recommended dosage instructions on the product label, or follow what your healthcare professional has advised. Be especially careful about taking multiple products that contain acetaminophen at the same time, because this can easily lead to an unintentional overdose. It's a good habit to check the ingredients of all over-the-counter and prescription medications you're taking. And if you find you need pain relief for more than just a few days, it's really important to consult your doctor. They can help you discuss the underlying cause of your pain and figure out the safest way to manage it long-term, especially if you have pre-existing kidney conditions or other health concerns. So, acetaminophen can certainly be a safe and effective pain reliever when it's used correctly. But it's important to remember that safe doesn't mean it's completely without risk, particularly with prolonged use or when it's combined with other things. All right, next up, we're going to look at another common NSAID that actually shares some similarities with ibuprofen in terms of its impact on the kidneys. Number 4, Naproxen. Moving on to number 4, we have Naproxen. Naproxen is another non-steroidal anti-inflammatory drug, or NSAID, that you can find both over-the-counter and by prescription. It's commonly used to manage various types of pain, inflammation, and stiffness, which makes it a frequent choice for conditions like arthritis, tendinitis, bursitis, gout, and menstrual cramps. Just like ibuprofen, naproxen works by reducing the production of those prostaglandins, the chemicals involved in pain, fever, and inflammation. One difference is that naproxen tends to have a longer-lasting effect compared to ibuprofen, which means it doesn't need to be taken as often, and some people find that quite convenient. But just like with other NSAIDs, the very way naproxen provides relief is also what can potentially cause kidney damage, similar to the effects we see with ibuprofen. By blocking that prostaglandin production, naproxen can reduce blood flow to the kidneys. This reduction in blood flow can then make it harder for the kidneys to filter waste products from the blood effectively and to maintain the proper balance of fluids and electrolytes in your body. If it's used for a long time at high doses, or if you're particularly susceptible, this can lead to various kinds of kidney injury. This could be an acute kidney injury, or even make pre-existing chronic kidney disease worse. There are several factors that can actually increase your risk of experiencing kidney problems while taking naproxen. Dehydration is a big one, as it further cuts down blood flow to the kidneys, which just adds to the effects of the NSAID. Also, taking naproxen at the same time as other medications that can be harmful to the kidneys, those nephrotoxic drugs we mentioned, like certain diuretics, ACE inhibitors, or even other NSAIDs, can really bump up the risk. And, as you might expect, prolonged, uninterrupted use of naproxen, especially at higher doses, also increases the chances of developing kidney-related complications down the line. Now, some groups of people should either avoid naproxen completely or use it with extreme caution and only under strict medical supervision. This definitely includes individuals who already have chronic kidney disease, as their kidneys are already working under strain. Older adults are generally more vulnerable due to those age-related declines in kidney function, and also because they're often taking multiple medications. People with conditions like heart failure or liver cirrhosis might also be at an increased risk, because these conditions can affect kidney blood flow and how their body processes drugs. So, it's absolutely essential for these individuals to talk about using naproxen with their healthcare provider to carefully weigh the benefits against the potential risks. To help minimize those kidney risks, the advice for naproxen is similar. It should be used at the lowest effective dose and for the shortest possible time. It's also really important to stay well hydrated while you're taking this medication. If you need long-term pain management, please consult your doctor about safer alternatives or different strategies. Always make sure to read and follow the label instructions for over-the-counter naproxen, and if it's prescribed, follow your doctor's specific directions to the letter. If you have any concerns at all about naproxen and your kidney health, especially if you're in one of those higher risk groups, having a conversation with your healthcare provider is absolutely essential. So, while individual NSAIDs like naproxen do carry their own risks, the danger can actually be magnified when different painkillers are mixed together. So, let's take a closer look at how these combinations can affect your kidneys. Number 5, combination analgesics. And that brings us to our 5th category, combination analgesics. So, what are these? Well, combination analgesics are pain-relieving medications that, as the name suggests, contain 2 or more active ingredients. These products often mix different types of painkillers, for example, an NSAID like aspirin or ibuprofen, together with acetaminophen. Sometimes, these products also include other substances like caffeine, which can boost the pain-relieving effect, or codeine, which is an opioid that provides stronger pain relief. You'll see these marketed for various types of pain, like headaches, migraines, and arthritis, often with the promise that they'll give you more effective relief because of the way their different components work together. However, and this is a big however, it's precisely this combination of ingredients that can pose a particularly high risk for kidney harm, especially if they're used long-term or excessively. In fact, combination analgesics, particularly those that used to contain a substance called phenacetin, which has mostly been taken off the market now due to kidney concerns, or those that mix aspirin, acetaminophen, and caffeine or codeine, have been most strongly linked to the development of that serious condition, analgesic nephropathy. This involves chronic inflammation and damage to the kidney tissue, and it can potentially lead to irreversible kidney failure over time. Now, how do these combination analgesics cause kidney damage? Often, it involves what's called a synergistic effect. This means the combined impact of the different drugs is actually greater than the sum of their individual effects on the kidneys. So, for example, one ingredient might reduce blood flow to the kidneys, while another might have direct toxic effects on kidney cells, or perhaps it accumulates to harmful levels. Even caffeine can play a role. While it might initially increase blood flow to the kidneys, it can also lead to diuretic effects. If you're not drinking enough fluids to compensate for that, it could contribute to dehydration and kidney strain, especially when it's combined with other drugs that are potentially tough on the kidneys. Given these elevated risks, some specific recommendations for using combination analgesics are really crucial. Generally, it's advised to avoid using these products for long periods, chronically, unless they've been specifically prescribed and your use is being monitored by a healthcare provider. If you find that you're relying on combination painkillers regularly, it's so important to seek medical advice. This can help you identify the underlying cause of your pain and explore safer, more sustainable ways to treat it. This is especially critical if you already have kidney risk factors like diabetes, high blood pressure, or a family history of kidney disease. And always make sure to tell your doctor about all the medications you're taking, including any over-the-counter combination analgesics. So, understanding the risks that come with both individual and combined painkillers is definitely the first important step. Now, let's move on to talk about how we can recognize and, hopefully, prevent kidney damage related to these medications. Recognizing and preventing analgesic nephropathy. One of the real challenges with analgesic nephropathy, that kidney damage from painkillers, is that it often develops silently. That means there might not be any obvious symptoms in its early stages. When symptoms do eventually appear, they can be quite non-specific. Things like persistent fatigue, unexplained swelling in your legs or ankles, or perhaps subtle changes in how much or how often you urinate. The unfortunate truth is, many individuals may not experience any noticeable signs until significant kidney damage has already happened. Because these symptoms can be absent or so easily overlooked, regular medical checkups and laboratory tests are really important, especially for anyone who uses painkillers like NSAIDs or combination analgesics on a long-term basis. Blood tests can measure things like creatinine levels and estimate your glomerular filtration rate, or eGFR, which are key indicators of how well your kidneys are functioning. Urine tests can also be helpful, as they can detect things like protein or blood in the urine, which can also be a sign of kidney problems. A key preventive strategy is to explore alternatives to long-term painkiller use. There are many non-medication pain management techniques that can be very effective for certain types of pain. Think about things like physical therapy, exercise, acupuncture, massage, or using heat and cold therapy. And if medication is still necessary, then discussing kidney-friendly options with your doctor is absolutely essential. So, when should you consult a healthcare provider? Well, if you've been using painkillers regularly and you're concerned about your kidney health, or if you develop any of those potential symptoms of kidney damage we talked about, it's time to make that call. This is particularly important if you have risk factors like diabetes, high blood pressure, heart disease, or a family history of kidney disease. Remember, early detection and intervention can make a huge difference in preventing further damage. So, to wrap things up, while common painkillers offer a lot of convenience, that convenience really shouldn't overshadow the potential for them to cause silent harm to your kidneys. Using them chronically or excessively can lead to damage that, in some cases, may become irreversible. That's why fostering awareness, knowing the risks, practicing moderation, and seeking regular medical guidance are such fundamental steps in safeguarding your kidney health while still effectively managing your pain. We hope this information helps raise awareness about the kidney risks that can be linked to common painkillers. If you're someone who uses these medications regularly, we strongly encourage you to speak with your doctor. They can talk to you about safe alternatives and the importance of kidney monitoring. We encourage you to think about these points and discuss them further if you have the opportunity, and always be on the lookout for more health tips on using medication safely.